This is a quick tutorial to show you the past medical surgery family history panel. That panel is up here near the top. Let's close out just to get oriented. HPI, past medical history panel. We also have the right panel, which is a summary of all the things in the past medical history panel. Let's expand out the past medical history panel. Built into the history section, the top section of our form, is another way to display, should you not wish to display the right panel over here. We have the past medical surgery panel here, which we can close. You can look at it through this form alone. Let's refresh this page once, make sure we have all the latest data. We're in the active chart, and we'll show the panel on the right. Fine. We have multiple sections, just like a regular chart. For ophthalmology and optometry, we have the past ocular history, past medical history, medication, surgery, allergy, family history, social history, and the review of systems. Each of the review of systems is encounter specific. The rest of these carry over from chart to chart. If we want to add a specific disease, for instance, past ocular history, we'd have basal cell cancer. We can select the date just like we would normally. If there's somebody who referred them in or a Mohs surgeon that's helping us, we'll save that information. Immediately gets stored as past ocular history here, and this and also displayed here in the right panel. Past medical history is exactly the same, slightly different format, very similar to the standard openEMR entry form that you find elsewhere. Medications, same situation. When does it start? Is it finished? If you click finish, it would automatically fill in that date. The surgery, when was the surgery? Who was the surgeon? What was the surgery? If you want to pick directly through the pick list, you can do that. Allergies, same situation. What is the allergy? What is the reaction? When did it occur? Any comments? One note, the quick pick list here is standard. On initial install, there are some preset variables that are placed there. After using the system, if there are more than 5 entries for any individual surgeon, these are surgeon specific, those will appear here in the order of their frequency. So the terms that are used more frequently will appear at the top of the list. Up to 10 will show up. But again, on starting this form, these are all pre-populated with generic terms. Over time, the openEMR eye exam learns each physician's individual preference, how they like to either document their glaucoma, whether it's pseudoexfoliation with +2 PXE, or basal cell cancer left lower with post-Mohs. Might be very surgeon-specific examples. Fentanyl laser with premium IOL, that could be another one that goes there. You get the idea. Same with past medical history, the medications, and the surgery. The family history, social history, and review systems are a little different. The family history is basically click, automatically goes to yes, and then you can type in if you want to change that field to describe more in detail what runs in the family. You click save after each one, enter that. Notice the family history here, it says glaucoma, mother open angle glaucoma. Same down here in the right panel. These two are mirror images of each other. The social history looks a lot like the openEMR social history form. And indeed, any changes that are made here will be directly reflected in the other areas of openEMR. They're working off of the same fields in the database. So no other forms, if they use these data points anywhere in the system, in fact, will anything break. Review systems is the same as family history. We just click on, click off. And if there is anything specific you want to say with each visit, that will be saved. When you save it, it's populated over here in review systems, and again over here in the panel. Hopefully that makes sense, and that we can get to work using this module in this form and